This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're heading up to the pulmonology department of the Aurora Medical Center to talk with Dr. Robert Geck. Now we're going to be talking about COPD and how it might affect you and what treatment options are available. Well, thank you for taking some time with us today. We're talking about issues with the lungs, and I think a lot of people have heard of the term COPD, but what exactly is that?
Well, COPD stands for chronic obstructive pulmonary disease. And much like the name says, it is a chronic disease of swelling, irritation, inflammation in the lungs that leads to obstruction and then destruction of the lung tissue, usually with a progressive course over several years.
Now, what would be some of the signs that a person might experience? You know, is it just a cough that could lead to a diagnosis of COPD?
And unfortunately, in COPD, the symptoms may not show up for years after they've had the destruction. And so it oftentimes takes a significant impairment in the lungs before they begin to notice a cough, maybe some shortness of breath when they're doing their daily activities or exerting themselves. Daily walk or some other yard work may show up as being more short of breath than they used to be.
Then if somebody is experiencing those symptoms, so should they get it checked out then immediately? Or?
They should be at least see their primary care doctor to explain it first. If they have a significant history of smoking or exposure to other inhalants or fumes, that may signal the significant impairment in their lungs as a result of that years of smoking or years of exposure.
How do you go about diagnosing COPD?
So COPD has a fairly loose diagnosis that deals with the presence of some inciting event before, whether you're a long-term smoker or you worked in a field where you had a lot of exposure to some sort of irritants or inhalants. And then we typically do some procedure where we'll look to see, is there impairment in the lung function? Do you have abnormal pulmonary function tests, is what we call them. Does it suggest that there's obstruction, like there is in COPD? And is it reversible or irreversible? And oftentimes those ones who are irreversible are labeled COPD, and we need to look at that.
What are some of the long-term effects that could happen if it goes untreated?
So if it goes untreated, COPD does definitely shorten your life expectancy. It also has a significant impairment on other diseases that go together. So heart disease, cerebral vascular disease, so strokes are impaired by that. There are a fair number of other things that are even more subtle, like diabetes management may be impaired by COPD.
So what would be the treatment plan for someone who has COPD?
The ideal thing for COPD is, one, to stop the inciting agent. So if you're smoking, you need to stop smoking. That has a significant improvement in your lung function later on down the road. And then with testing, we can determine how severe your impairment is and then consider other inhaled medications, whether they be things like albuterol or something like that, or more severe or more significant medications like inhaled steroids to try to treat those disease processes. The most important thing is to stop smoking.
Outside of stopping that smoking habit, are there other things that a person could do themselves to try to reduce the symptoms of COPD?
Exercise is probably the biggest thing. So as we begin to be short of breath with exertion, people will have a tendency then to slow down or stop doing those things that make them short of breath. And that makes things probably worse. We need to stay active. Those people need to maintain their activity and continue being active. As you start to decrease your activity, then you start running into lack of physical fitness and some other things. In fact, in a lot of people who have kind of in the middle of the road COPD, we actually prescribe physical therapy to learn to get that strength back, to improve that efficiency of the body and achieve some cardiovascular fitness so that they can have better symptoms.
How about something as simple as a flu vaccination? Would that help as well?
Those are also very important. So regular vaccinations with the flu, but also trying to obtain the pneumonia vaccine prevents recurring infections that can actually worsen the COPD in a faster way.
So it sounds like getting diagnosed, getting treatment, that can certainly not only lengthen your life expectancy, but also improve quality of life, I would imagine, as well.
Exactly, and the key to treating COPD is there's no reversal of the symptoms of the shortness of breath. We can improve it with those inhaled medicines, but more importantly is to try to decline or slow the decline in lungs. And so preventing infections, preventing hospitalizations, keeping you at home are the goals of all the therapy.
Okay, and again, if somebody is experiencing these symptoms, best to go get checked out right away.
Exactly. Have your primary care doctor see you, evaluate you. If there is some concern for a lung dysfunction, again, referral to a pulmonologist if it's needed.
All right, well, thank you for taking some time with us today.
I appreciate it. Thank you.
Now, if you're experiencing any of the problems Dr. Geck was talking about, you should check with your primary care provider. If you have other questions, you can always give Dr. Geck a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.